Okay, so final view I want to talk about is the inferior view of the skull. So we've taken this internal view and we flipped it over. So we're going to see some of the same things from this view and some new things. So let's talk about what I might ask you on the lab exam. So let's start anteriorly. We again have that hard palate. So we're going to have the perpendicular plate of the maxilla and then the horizontal plate of the palatine bone forming our hard palate. Would I ask you zygomatic arch from this view? No. But there are a couple features of the temporal bone that we can see here. So these are the same things we saw from that lateral view. So just to orient ourselves, this is temporal bone. We have the external acoustic meatus in this case, mandibular condyle, styloid process, nice and pointy, and then we have our mandibular fossa. So let's put the stick on that fossa, and now we're looking at it from that inferior view. So we still have our mandibular fossa, still have our mandibular condyle. Styloid process is a little harder to see here, but we could still ask you that from an inferior view. We also have, just to orient ourselves, we have the nasal septum. So I would not ask you this from this view, but if you're trying to figure out what the heck you're looking at, you can use the nasal cavity and the nasal septa to orient yourself. We have some new features here of the occipital bone that we can see. So these two surfaces here are our occipital condyles, and they are going to articulate with the atlas and axis of our vertebrae to form that occipital atlas or atlo-occipital joint. What else can we see here? So if we stick with the occipital bone, we have this bump here. This is called our external occipital protuberance. And you can palpate it on yourself. So if you run your fingers up your skull until you reach this bump here, this is our external occipital protuberance. All right? Let's see, what else could I ask? We have foramen magnum, of course, our largest of the foramen. Laterally, we're going to have our jugular foramen. So the way I identify this is I look for the styloid process, and then jugular foramen is going to be just posterior and medial to it. So we have this nice opening here. We've got it on the other side here. So look for your styloid process first, right here, and then once you find it, just medial to that, we have our jugular foramen. Alert, there is a new opening here that we can't see from any other view, and that is going to be our carotid canal. So carotid canal is right above our jugular foramen, so it's right here. Okay? Don't get that mixed with our acoustic meatuses or the jugular foramen. So use the stylus to orient yourselves. Medially and posteriorly, we have jugular foramen, and then just above that, we have our carotid canal. Okay, just make sure you haven't missed anything here. Again, we have our foramen lacerum, so you can see that here. And then if you ever want to double check, all you need to do is stick a wire or one of these Q-tips through here and see where it comes out in the internal view or interior view. So this is definitely our foramen lacerum. All right. Ooh, make sure we're in the same orientation here. Okay, so we can see foramen lacerum. We can also see our foramen ovale. So that's going to be this guy. Ta-da! So, stuck my stick through here. I think it's foramen ovale, but let's check here. And there we go. That is definitely our foramen ovale. So these are exact techniques I want you to use when you're practicing in lab. When in doubt, stick a wire through it and see where it comes out, and that will help you confirm your answers. Couple other things we can see from this view are the medial and lateral pterygoid processes. So we haven't talked about these a lot, but we have a medial and a lateral pterygoid process on either side of our femur. So this would be medial, and then this would be lateral. They're a little trickier to see. So lateral extends more like a wing. Medial is more of an up and down projection here. Again, I'm not likely to ask you that on a lab exam, but these are good things to know. We're at the level of the nasal cavity here, and then now we're getting into the oral cavity. So you can actually palpate your pterygoid processes. If you stick your tongue way back into the side of your mouth, we've got these little arches. They're like fleshy arches. They are in part shaped by our pterygoid processes. So, food for thought. All right, I think that is everything I could possibly ask you from this view. I would focus more on temporal bone features and occipital bone features. I could ask you jugular foramen or carotid canal. Those are great candidates. But any other opening here, there's probably a better perspective, such as for foramen ovale and lacerum. I'm much more likely to ask you those from that interior view. So, good luck studying. The best way to study is just repetition, repetition, repetition. So I would not recommend trying to memorize bones or landmarks on their own. For example, don't isolate the sphenoid bone and try to identify everything there. Because remember, sphenoid bone is deep. And we don't have a clear boundary between the sphenoid bone and the temporal bone, or between the petrous portion of the temporal bone and the occipital bone. This stuff is not nicely labeled. So the best way to practice would be get your skull or get an image of a skull and just try to identify the stuff that you see from this view. So don't break it down by bone. Always study from that macroscopic perspective. I would spend a lot of time on the anterior view. So from here we can see a lot of those facial bones and their associated landmarks. Spend time laterally looking at the TMJ and the temporal bone, as well as that zygomatic arch. Spend most of your time from this interior view looking at landmarks and foramina, and then from the inferior view with those specific bony landmarks that you can't see from any other view. So, good luck and happy studying.